So let's dive into some neuropathology. So the first thing we're going to talk about is syringomyelia. So syrinx is nothing but a cyst, okay, a fluid-filled cyst, and myelia is nothing but your spinal cord. Your myel means spinal cord, okay. So there is a cyst or a syrinx inside your spinal cord. So as you can see in this in these MRI images here, this cyst, this fluid filled cyst is called a syrinx, okay. You can see it here also, it's a small one, and here this is a bigger one. All right, so this syrinx is usually seen in the cervical column. As you can see in both these images, it is in the cervical column. This is a little bit below, but this is properly in the cervical column, right? So what this does is, because of this cyst here, it compresses some nerves that are running through like this, okay. So we know that this is the neck, right, and these are your hands, okay. I'm sorry, I'm bad with diagrams, but anyway, just think of this as your neck and these are your arms. So when there is a syrinx here posteriorly, this here some nerves are getting compressed, okay. So nerves passing like this are being compressed because of this cyst. So when these nerves are not traveling here, you'll have some problem in both your arms, right, because this syrinx is obstructing the nerves going, right. Therefore, the patient will have bilateral loss of pain and temperature in the upper extremities. This will look like a cape, okay. So a cape is nothing but this here. So this thing that is covering your arms here, that is the cape, okay. So like this and this, okay. So this is nothing but a cape. So I'll try a better diagram. Neck, these are the guys' shoulders. So when there is a syrinx here, the nerves going here are being obstructed. Therefore, there is no temperature or pain sensation over your upper limbs, right? So this is like you're wearing a cape, all right? Therefore, this is called cape-like bilateral loss of pain and temperature. So when this syrinx is in the cervical column, this happens. But imagine the syrinx being somewhere below, like over your lumbar area or your thoracic area. So that will lead to weakness in the legs, right? Not just arms, but also legs. And the patient will also have bladder disturbances, right? And syrinx here, a proper syrinx here, which is obstructing the, CSF flow and everything else. Therefore, the patient will also have headaches. So the investigation will be MRI, gold standard. As you can see in this image itself, these two are MRIs and we can clearly see the syrinx here. So this is all about syringomyelia. So there is another disease called syringobulbia, which is similar to syringomyelia, except that syrinx is affecting your bulbar areas. So bulbar is nothing but where your cranial nerves, okay, cranial nerves. So this is again when the syrinx is inside the medulla, okay. So as you can see, this is the medulla, and here we have some cranial nerves, right? The last 4 cranial nerves, 9, 10, 11 and 12 cranial nerves pass through the medulla. And if the syrinx goes a little upwards, it may also be in the pons. So that would be your middle 4. That will be 5, 6, 7 and 8, right? So these cranial nerves will be affected. So along with syrinx, or like the bilateral arm weakness symptoms, along with that, if you also have cranial nerve symptoms, that would be syringobulbia. All right. So that's all about syringomyelia and syringobulbia. Thank you.